Yesterday, Lisa called me, totally baffled. She had bought a blood pressure monitor the day before and tried measuring her blood pressure several times. However, the readings were inconsistent, sometimes higher, sometimes lower. Now she's wondering if the device is broken or if she's doing something wrong. Actually, it's a common issue. In my experience, very few people can measure their blood pressure accurately, and it's usually those who have had professional training that manage to do it right. There are many pitfalls when it comes to measuring blood pressure. The first common mistake is the posture when measuring blood pressure. Some people prefer lying down or standing while taking their blood pressure, but this is not ideal, as body posture can affect the blood pressure readings. Even when seated, if they sit too high or too low, with their arms not resting flat on the table, or if they cross their legs, all of these factors can affect the measurement results. The second common mistake is that many people don't take enough rest before measuring their blood pressure. I often see people rushing into the pharmacy, heading straight to the blood pressure monitor, and sitting down to measure immediately. This often leads to inaccurate measurements. The correct method is to rest for 3 to 5 minutes before measuring. Another common error is when individuals place the cuff over thick clothing. This practice is also ineffective. Furthermore, some people, in an effort to prevent the cuff from being placed over their clothing, deliberately roll up their sleeves, inadvertently constricting their arms, which can also result in measurement inaccuracies. In addition, some individuals position the cuff too high or too low on the arm, and there are even those who place the cuff directly over the elbow crease. These practices also lead to inaccurate measurements, and speaking, eating, or using your phone during measurement can also skew the results. Understanding these common mistakes gives us a clearer picture of how to measure blood pressure correctly. Ideally, measure your blood pressure before breakfast and dinner. But if that's not possible, remember, avoid strenuous activities, smoking, drinking, and caffeine 30 minutes prior. And don't hold your bladder. Rest quietly for 3 to 5 minutes before measuring. Sit in a chair with back support, feet flat, and legs uncrossed. The upper arm used for the measurement should be bare or covered by just one layer of clothing without rolling up sleeves, and the bottom edge of the cuff should be positioned about 2 to 3 centimeters, approximately 2 finger widths, above the elbow crease. Take 2 readings, 1 to 2 minutes apart, and average them. If there is a difference of more than 10 millimeters of mercury between the 2 readings, it is recommended to measure a third time, and the average of the last 2 readings is then taken. Initial blood pressure measurement should be taken on both arms, and the higher reading is considered. In case of continuous monitoring, for initial diagnosis or uncontrolled blood pressure, measure at least 3 consecutive days a week. For well-controlled blood pressure, once or twice a week is sufficient. In conclusion, measuring blood pressure accurately is vital for our health. We hope Lisa and everyone can master the correct method to maintain normal blood pressure. If in doubt, consult a doctor or professional. Remember, health is our greatest wealth. Let's cherish it. Wishing everyone a healthy body